Welcome to Dr. CM Edcast, your go-to resource for medical learning. Through discussions, case studies, tutorials, and debates, we help you learn, grow, serve.
The human skull. We often think of it as this simple, solid helmet, but in reality, it's much more like a complex, living puzzle. So in this explainer, we're going to piece that puzzle together, exploring the incredible architecture that not only protects our brain, but also, quite literally, shapes who we are.
All right, so here's our game plan. We'll start with the foundational anatomy, the basics. Then we'll take a really detailed tour of the adult skull. From there, we'll venture inside to the cranial cavity. And then we'll compare all of that to the amazing neonatal skull. We'll finish up by exploring the critical openings that connect our brain to the rest of the body. Okay, let's dive right in.
So let's kick things off by clearing up a common misconception. The skull, it's not one single solid bone. Nope, it's actually a collection of many separate, flattened bones, all intricately joined together, almost like the plates of a suit of armor. And this very clever design, well, that's the secret to its incredible strength.
These interlocking joints are called sutures. They're fused together by this tough connective tissue, a sutural ligament, creating a really rigid protective shell. But there's one key exception to this immovable rule, and that's the mandible, or your lower jaw. It is the only bone in the skull that's designed to move, and that's what allows us to talk, to eat, and to express ourselves.
So, with that foundation, let's begin our tour of the adult skull. Now, the easiest way to think about it is to divide it into two main groups of bones. You've got the cranium, which is the case for the brain, and then you have the facial bones, which create the framework of our face. Let's start with the cranium, or the brain case. Think of it as our own personal vault, and it's built from 8 very specialized bones. We have the frontal bone, which forms the forehead. The 2 parietal bones create that curved roof on top. The occipital bone guards the back, and the temporal bones protect the sides. Then, if you go deeper inside, you find the really complex sphenoid and ethmoid bones that form the intricate floor of this whole cavity.
Next up, we have the facial skeleton. This is the framework of our identity, and it's made up of 14 different bones. The zygomatic bones, those give us our cheekbones. The maxillae form the upper jaw, and the nasal bones shape the bridge of our nose. And of course, there's the mandible again, that one mobile bone that really completes the picture. Altogether, these bones create the unique landscape of every human face.
Okay, so let's start our tour from the front, the anterior view. This is the face we present to the world, right? You can see the broad frontal bone making up the forehead and the orbits providing a safe harbor for our eyes. Below that, the nasal cavity opens up, framed by the maxilla and anchored by that powerful mandible at the bottom.
Now, let's move to the side, to the lateral view. What's so interesting here is that you can really appreciate how these different bones interlock in such a complex way. You can see where the parietal bone meets the temporal, the sphenoid, and the zygomatic. It's just a fantastic illustration of how all these separate pieces come together to form one incredibly strong unit.
And now for the inferior view. So we're looking up at the base of the skull. It is a really complex landscape, but it holds the key to our connection with the rest of our body. The most obvious feature here is the foramen magnum. That's the great opening, where the spinal cord joins the brain. And up here at the front, you can see the hard palate, which is the bony roof of our mouth.
Our tour of the exterior wraps up with the back and the top views. So from the back, we can see the protective curve of the occipital bone. But the view from above, this is where you can see the true genius of the skull's design. You get this incredibly clear view of that intricate network of sutures, the coronal, sagittal, and lambdoid, that bind all those cranial bones into one single unified structure.
All right, now that we've seen the outside, let's move inside the brain case, into the cranial cavity. This is the internal space where our brain is housed, protected, and supported.
Welcome to the inner sanctum, the floor of the cranial cavity. You'll notice right away it's not a flat surface at all. It's actually a series of 3 terraces or fossae that kind of descend like a shallow staircase. This ingenious design provides a perfectly custom-fit cradle for the delicate structures of the brain.
So let's break down these 3 levels. The highest level is the anterior cranial fossa, and that's what supports the frontal lobes. Take a step down and you find the middle cranial fossa, which holds the temporal lobes. And finally, the deepest and largest of the 3 is the posterior cranial fossa, and this is what houses the cerebellum, the pons, and the medulla oblongata.
But you know, the skull isn't always this rigid, fused structure we've been looking at. At birth, it's remarkably different, and for some very, very important reasons. So let's shift our focus to the neonatal skull for what is a really fascinating comparison.
Honestly, the contrast between the adult and neonatal skull is it's breathtaking. An adult skull is a fortress. It's rigid, unyielding. The newborn skull, on the other hand, is a work in progress. Its bones are still separate and pliable. And then, of course, you have the fontanelles, the famous soft spots, a feature that is completely unique to the infant skull.
And these fontanelles, these membranous gaps between the cranial bones, they are just a marvel of biological engineering. They have two absolutely vital jobs. First, they allow the skull to change shape and safely compress during birth. And second, they accommodate the explosive growth of the brain that happens in the first year of life. They're a temporary feature for sure, but an absolutely crucial one.
For our final section, we come to an absolutely essential feature. You see, the skull is not a solid, impenetrable fortress. It's actually perforated by dozens of openings called foramina. And these aren't defects, they are vital passageways.
Think of these openings, these foramina, as the gateways to and from the brain. The foramen magnum is the grand entrance, where the spinal cord meets the brain. The optic canal is like the window to the world, letting the optic nerve carry all that visual information. And the jugular foramen is a busy thoroughfare for major blood vessels and nerves. Without these passages, the brain would be a prisoner in its own fortress.
And this brings us to a final thought. The skull perfectly embodies this fundamental biological paradox. It is an armored fortress designed for maximum protection, but at the same time, it's also a complex highway full of passages that are essential for communication and for life. And how this elegant balance of strength and openness works together? Well, it truly defines our ability to perceive, to think, and to exist.